Yeah, I'm very excited to have Leigh Phillips join us. Leigh Phillips is one of the smartest, boldest, best thinkers on the left, in my opinion. He's an author, science writer. He wrote a book called The People's Republic of Walmart. He wrote another book called Austerity, Ecology, and the Collapse of Porn Addicts, A Defensive Growth. I see what you did there. Progress, Industry, and Stuff. Leigh, thank you for joining us. How are you?
Good to be here.
So, Leigh, I remember listening to you on Chapo, I want to say like a year ago or something, and you kind of predicted this pandemic stuff. Not the actual pandemic, but the weakness of our ability to deal with a potential pandemic. So I wanted to ask you about that. Like, how have you been living through this, knowing that you kind of saw it coming, that you were kind of a Nostradamus for all of this?
I don't know. It's pretty weird. I mean, I'm just reporting on this stuff. I would imagine that the clinicians, the coronavirus specialists, the public health officials who've been warning about these problems specific to coronaviruses, but also with other issues related to infectious disease, particularly around antibiotic resistance for years. I imagine they are very frustrated and furious that this is being allowed to happen. You know, hundreds of thousands of deaths, and we knew this was coming. And all of them, from the get-go, have said that the fundamental problem is a lack of market incentive. So these aren't radicals. These aren't democratic socialists saying this. These are just specialists in their own field. After the SARS outbreak in 2003, and then about 10 years later, the MERS outbreak, Middle East respiratory syndrome, two other novel coronaviruses. They were putting out papers, review articles, making public statements, saying that the fundamental problem is that there aren't enough patients with these what turned out to be smaller outbreaks, but we didn't know that they were going to be small. They're in some cases, particularly with MERS, they're simply in the wrong place. So in the Middle East, the patients aren't going to be wealthy enough to care about. Then the sort of coronaviruses the endemic coronaviruses, that is the ones that are just around, that we've dealt with for hundreds, thousands of years, which cause some amount of the common cold. The impact is simply too mild for drug companies to care about. And the fundamental problem here is that there's just a huge, high cost of drug and vaccine development means that if there aren't enough people to buy the product, it's not going to be profitable. And you can compare that to, it costs roughly about $1 billion US for every new molecular entity, or effectively drug. So if you're going to be spending $1 billion to develop that, to take it through clinical trials, and at the end of that, you have somebody who, let's even say that it's successful with the case of antibiotics. You're taking antibiotics, a course of antibiotics for maybe a few days, few weeks, with tuberculosis, maybe a few months at the most. And then if it's working, you don't take it anymore. Well, compare that to some drug for a chronic disease for which the patient has to take the drug every day for the rest of their life. It's just the market incentive pushes the company in that direction and away from developing antibiotics. And they got out of the development of antibiotics, out of vaccines for about 3 decades ago.
Yeah.
Wow, it makes a lot of sense. But oftentimes the argument you hear from libertarians is, without the incentive for innovation that comes from capitalism, you wouldn't have the development of new drugs or vaccines. It's really it's the financial incentives that pressure people or at least incentivize people to develop these types of medicines and vaccines and services. And so what's your response to that? So let's say, we're functioning under a socialistic society where we're not relying on free markets for innovation. How do you envision pharmaceuticals to be developed, innovated?
Right. Well, there's two things to say about that. The first is that there's nothing wrong with these companies when they're producing something that we need, if it's profitable. So that's great. I'm happy that they're doing that. The problem comes when we know that we need to develop something, but it isn't profitable, or it's even insufficiently profitable, and they just won't produce it. The second thing that I would say is that the reality is the vast majority of medical research is not actually performed by the large pharmaceutical companies, but instead by government laboratories or university laboratories, effectively funded by the public sector. The story that libertarians tell about the bravery, the risk taking of entrepreneurs in the private sector, it's just not really true. What we need is we need to take pharmaceuticals out of the private sector and put them entirely into the public sector. In Canada, in much of Western Europe, healthcare has largely been taken out of the private sector. And that's great. You don't have that in the United States yet, which is unfortunate. But even in these places, we've basically only done half the job. The other half of the job of bringing social justice to healthcare is to take pharmaceuticals out of the private sector and effectively nationalize them. And then when we recognize that there's something that we need to do and it isn't profitable, we can cross-subsidize that by spending the money, the revenues that we get from the profitable drug.
Mm-hmm. So basically, something that really... Go ahead.
I was just going to say, basically like the postal model, really. It takes a lot of labor, and it's very expensive to send a letter from New York to Anchorage, Alaska, but you don't pay that much more to do it. What happens is that those routes that are highly profitable, where there's great population centers, they cross-subsidize the sending of letters or packages or whatever to those other areas. That's in the public postal service. And the idea behind that was that regardless of where you live in the United States or in Canada or where it happens to be, no matter if you're in a remote rural area, by dint of being a citizen, you have the right to the same access to communications as anybody in a major city. And we should say exactly the same thing with pharmaceuticals. The profitable drugs would subsidize the unprofitable ones.
Yeah, I love that you drew that parallel, because if you look at privatized delivery companies like UPS or FedEx, they do not deliver to rural parts of the country. In fact, what they'll do is they'll deliver it to one other like densely populated part of the country and then rely on the postal service to deliver to rural areas. So I think that parallel is really important.